Assalamualaikum and salam sejahtera to the panels and everyone watching. We are from Group 105. My name is Faridah Hanim Roslan.
My name is Siti Binti Hashim, and we will present on our research study on the effectiveness of digitalization healthcare system in Malaysia during COVID-19, supervised by Dr. Zarina Muhammad Zain.
Let's start with the research background first. Okay, coronavirus, also known as COVID-19, is an infection that is caused by the SARS-CoV-2 virus, which is transmitted through the air and have been declared as the global health emergency because of its potential to cause severe illnesses or even death. This deadly virus outbreak has had a massive impact all across the globe, including Malaysia in a lots of ways, which the daily cases in Malaysia keep increasing and increasing till many dies due to the virus. And as the country fights with the outbreak, healthcare system are the most vulnerable since they are given the responsibility with the saving life of COVID-19 patients while also providing essential health services to those who were not infected with the virus. In response to this matter, the Malaysia's Ministry of Health MOH has introduced digitalization of healthcare system to ensure that the country's health sector continues to operate effectively and efficiently at the same time. Actually, apart from My Health Portal, the Ministry of Health MOH has created some more other online healthcare platforms during the COVID-19 for the public's convenience, including online appointment services, alert COVID-19 info via both My Government website as well as My Sejahtera apps. And actually all this is an effort from the government, especially from the MOH itself, to curb and flatten the curve of COVID-19 cases in the country at the time and till today. Next, on problem statement, COVID-19 has actually indeed transformed the lifestyles of almost everyone throughout the globe, including Malaysia. And this also applies to the Malaysia's healthcare system, which experienced several digitalization during this pandemic period. And the topic of digitalization is actually quite interesting because lots of articles, journals, news and so many people have discussed on how it changed the world, especially in terms of healthcare delivery. And a previous study by Toby et al. Found that digitalization of healthcare really aids the health sector in its effort to operate in more efficient manner in order to assure the ongoing delivery of healthcare to the public at large across the nation. And there is no denying that the digitalization of healthcare system has transformed healthcare landscape in some way since the COVID-19 outbreak struck our country over the last year, either in positively or negatively way. Of course, the digitalization of healthcare has taken place. However, the question here are people aware of it, reaping the benefits of it, and being satisfied with the system of it. All of these are interesting topics to ponder, and actually they have inspired this research.
In the table here listed 3 research questions and 3 research objectives, which is to study the level of usage of digitalization system among healthcare sectors, to identify the elements that contribute to the effectiveness of digitalization of the healthcare system, and lastly, to recognize the impact of utilization of digitalization in the healthcare system. From the conceptual framework, we can see that there is a direct relationship between independent variable and dependent variable. The first independent variable is patient empowerment. Findings from CROSS show that healthcare effectiveness can be affected by patient empowerment. Using an online portal to communicate with a healthcare provider can improve a patient's entire experience with their treatment. In this study, the researcher referred to that if the patient is empowered, thus it will bring to the system effectiveness. Next is patient satisfaction. High level of satisfaction can lead to the success of the digitalization of the healthcare system because of its self-efficacy and technological access advantage. E-health may make healthcare more accessible by making it more straightforward and seen to be of higher quality. And according to the research, people would recommend telehealth consultation to others, and the majority stated that telehealth made it easier to obtain healthcare services. Hence, this study agree that a system is effective if it leaves patients satisfied with their experience. Next is multi-channel behavior. Krauss mentioned that factors determining the effectiveness of healthcare system digitalization include the multi-channel behavior toward healthcare services. And lastly is operational and services efficiency. Factors determining the effectiveness of healthcare system digitalization include the operational efficiency and performance toward healthcare services. A report by the European Union titled Assessing the Impact of Digital Transformation of Health Services mentioned that healthcare system performance as well as healthcare delivery are among those who will be influencing the effectiveness of healthcare digitalization. Hence, these studies agree that the performance of the system will lead to the effectiveness of digitalization. And the study dependent variable is the effectiveness of digitalization in the healthcare system. And changes in these four independent factors may have an effect on the dependent variable. Based on the conceptual framework described above, it is assumed that there is a relationship between the independent variable and dependent variable in the study. Research methodology. We use quantitative method as our research design where we conducted a survey through Google Form for the unit of analysis, the medical practitioner of Pantai Kelang Hospital and Tengku Abdul Rahim Kelang Hospital, and the patient who get the treatment from the hospital serve as the study units of analysis. For the sample size, a total of 100 medical practitioners from Pantai Kelang Hospital and Tengku Abdul Rahimah Kelang Hospital will take part in the study, and 100 patients of both hospitals will be chosen to participate in the study. And the study will enlist the participation of 200% in total. In this research, the method that has been chosen is convenience and purposive sampling. For the data measurement, we use Likert scale, and for the data collection, we obtain the data through the survey of questionnaire using Google Form. The data analysis used in the study is descriptive analysis, uh, correlation analysis, and also multiple regression.
For findings, we will first look into the demographic profiles of the respondents for our study. And according to the demographic profiles, a total of 200 persons participated in the survey, with the majority respondents being female, totaling of 117, which about 58.5%, followed by males 83, about 41.5% from the respondents. And the majority respondents, about 66 respondents in total, are between the age of 39 and 48 at 33%. Meanwhile, the lowest response rate reported among people aged 49 years old and above. And the entire status of respondents is the same or equal, with 100 respondents representing patients, and the remaining 100 is from medical practitioner. 50% from respondents are from Hospital Tengku Abdul Rahimah, and another 50% are from Hospital Pantai Kelang. Next, most of the respondents' level of education is at higher education, with a total of 136 at 68% of the respondents. Continue from the previous slide. For the occupation, most of the respondents are from public sectors. For the response rate that we collected for the study, we found that almost 100% of the respondents have used the My Health portal in their life. a total of 198 participants, which is about 99% of the response rate of them have visit My Health Portal, with the majority of them total of 104, of which 52% utilize a smartphones to access the portal. Proceed to the main findings for this study. For the first objective for this research, the analysis that have been used is descriptive analysis. From the analysis, it is found that 99% of the respondents have used digital health apps before. So this study can draw the conclusion that the majority of people who participate in the survey had used some kind of digitalization within the context of healthcare system at least once in their lives. Next, in order to accomplish the purpose of the second research objective, this study have been using Pearson correlations to study the relationship of each independent variable with the dependent variable, and via multiple regression in order to further study the element that contribute the most to the effectiveness of digitalization of healthcare system in Malaysia. And looking at the results, this study has been showing that each of the independent factors does have a relationship with the dependent variable. In terms of individual factors, patient empowerment IV1 become the most influential, then followed by patient satisfaction, which is IV2, with the second most influential, and the third most influential is multi-channel behavior IV3. And lastly, the least influential element is the operational and services efficiency, which is IV4. And from the multiple regression analysis also, the study has come to the conclusion whereby all the 4 independent variables in the study have significant influence on the effectiveness of digitalization healthcare, and at only 31.1%, and which means about 68.9% of the elements influencing the effectiveness of healthcare digitalization are not being covered in this study. Hence, more study or future research is needed to study more on the elements that contribute to the effectiveness of digitalization of healthcare system in Malaysia. Lastly, for the third objective, this study have been using the multiple regression analysis, and by looking at the results, the impact 3, which is fast information spreading, is the most influential with beta value of 0.304. And for the overall interaction and influence between impact 1, which is change people awareness, and impact 2, which is improve quality of treatment process, as well as impact 3, which is fast information spreading towards the dependent variable, is explained with R square value at 23.3%, meaning that more than 70% of the impacts are not being covered in the study. So more future research is needed to study more on the impacts of utilization of digitalization of healthcare system in Malaysia.
Study limitation may arise owing to the constraint on research design, technique, materials, and this issue may have an influence on the study's finding. Hence, this is the limitation that we encountered while conducting the study. The first limitation is insufficient sample size. It is important to have an adequate sample size while performing the study in order to achieve reliable results. In this study, the researcher used a sample of 200 participants drawn from 2 hospitals. The sample size can be considered small because it limited to 2 hospitals. Therefore, the result may not reflect a wide community. Next is in terms of the method. We use quantitative survey as our method of study. One restriction is that the result of quantitative studies are less detailed because the option of result are dependent on numerical replies. There is a high possibility that the majority of the result will not provide much insight into the participants' thought and behaviors, and as a result, the outcome may be devoid of sufficient context. Furthermore, quantitative research might be considered limited. Quantitative research utilizes preset response that may question how individuals truly behave or think, prompting them to choose an answer that may not reflect their true thoughts. Lastly is on the variable selection. This is due to the fact that the independent variable in this study are limited to 4. As a result, it is difficult to collect correct data on the variables of the respondent, since researchers conduct the research study solely on 4 independent variables. Furthermore, there are several other effects that may have an impact on the research, on the success of digitalization in the healthcare system. However, in order to obtain data relating to the conceptual framework, the researcher required to identify the 4 variables. Advancements of technology is a powerful weapon in the development of a country. The much more advanced the technology accessible, the more rapidly the local economy may expand and develop. Digital technologies provide new opportunities in delivering healthcare, from disease prevention to health promotion, and as a result, they have the potential to change healthcare services, perhaps leading to health system goals of healthcare efficiency. And when it comes to the COVID-19 pandemic, the study has learned that healthcare application can help with contact tracking tactics in order to control and reverse the spread of COVID-19. The use of health application has aided health authorities in tracking and managing the continuing COVID-19, is the organization of patient medical follow-up, and given direct information to people on their role in disease control.